Right. So hi everyone. I am Dr. Olivia Richman. I'm a family medicine physician. I live in Pennsylvania, and Medical Marvels invited me on to talk to you all. Who's here now, who's ever, going to be watching on Instagram or YouTube, whatever it is. And so I just want to say to who's here now, feel free to unmute yourself, pop in, interrupt me. I want this to be like a very free-flowing conversation. If you have any questions, there are no dumb questions whatsoever. It could be the most basic question. I'm going to be so excited to answer it. So whatever it is that you want to ask, feel free, do whatever makes you comfortable, but I am more than happy to ask all of the questions. Doesn't matter what it is, all right? Do either Abigail or Michelle, do either of you want to say anything before I get started?
No, you can just go ahead.
Okay, cool. All right, so I'll just tell you a little bit. Well, actually, I kind of want to know who my audience is. I know Michelle and Abigail are both in high school. So Rishika, Ashley, Rahat, Chris, like, can you guys just, you don't even have to, I mean, if you could like unmute yourself or type it in the chat box, or maybe Michelle or Abigail knows, but like, just so I know who I'm talking to, like, I don't want to talk to like, yeah. High school. Okay, great. Sophomore in high school, awesome. Okay, fantastic. College, all right. All right.
I'm a grade 9 IB student in Kitchener.
Say that one more time.
Grade 9 IB student.
Okay, all right, great, yay. Okay, cool. So, good, now I just have an idea of who I'm talking to, so this is great. So I'm assuming you're here because you're interested in going into medical school and becoming a doctor, or somewhere in that field. It could be a PA, a nurse, whatever it is, but I'm assuming we're talking about MDs or DOs right now. So I, like all of you, I also had an interest in medical school while I was in high school, probably even, before high school. And oh, by the way, let me just tell you this now. You could follow me on Instagram at Dr. Olivia Richman, just DR, and then my first name and my last name. So if you have any follow-up questions, feel free to DM me on Instagram. All right. So yeah, I always had an interest in it, and I worked and did like summer jobs at like healthcare centers. In high school, I did that. And then also I did that in college. So high school, I was definitely like feeling out the field of medicine. And my mom's a doctor, so I was able to kind of like get a taste of it. That's not to say if a parent isn't a doctor, you could still 100% get a taste of medicine. You just have to like apply to like healthcare centers. It doesn't have to be hospitals. It could be like a small clinic in like your town. That would be really, really good experience for your resume. And let me see. Hi, Harshita. I just had people like tell me in the group chat, like who you are, or like where you are in your stage of life, like high school or college. So if you want to like pop that in the group chat, feel free. So yeah, so throughout high school, that's what that was. High school. All right, cool. So in high school, that's what I did. I was just kind of like dipping my toes. It's not super important in high school. If you want to build your resume, that's fine. The amount of responsibility that you're getting in high school, I feel like is like, it's kind of small, but it still shows your interest. But I really feel like in college, that's when you're able to really build a robust resume. So when you're in college, you want to join all of the whatever groups that interest you. I don't want you to just be like just joining medical groups, because honestly, in my opinion, at least, that kind of gets boring. I have like a very, like, I am a doctor, but like I have a very creative side as well. Like I have a YouTube channel. I love producing content on YouTube. It's not just medicine. And I think that that's something to keep in mind, even when you are applying to medical schools. But let's backtrack and like just stay on the college route right now. So in college, you just want to make sure that you have interests, different resumes, or different things on your resume that is comprehensive, and actually do things that you like. Like, don't do things just to build a resume because you think it's going to look good. Like, just remember, like when you start college and even in high school, like this is your time to explore. I know you're all like, it's medicine and that's that, and that's awesome. And I highly recommend this field. And also, I think it's so important to explore things that are completely opposite of medicine. It's long hours, and you just want to know that this is really the field that you want to get into. Not to say it's, a field that should scare you, but it's just know there's a billion options out there for what you actually could do as well. So I think that's a really important point to take away, especially in high school, especially in college, that you want to explore all of the options that are really interesting to you. So that's that. And then medical school. Medical school is rigorous. You're going to study a lot. You're going to make really awesome friends. And then you apply for your residency. And so like, that's what medical school is for. Like medical school is to look at all the options. Like maybe you want to be a surgeon, maybe you want to be an anesthesiologist, maybe you want to be a pediatrician, but like, that's where you could really hone in on what you want to do. Choosing to go to medical school is really just choosing to have a career where you are using your brain for difficult problem solving. Like that's how I like to see it. So like if you want to use your brain to be able to solve problems that are challenging, then that is a great field for you, because there's not like a one solution to everything. You really have to get creative and, of course, like follow the guidelines, but that's why medicine is an art. So what else do you guys want to know? Does anyone have like burning questions?
Can you share some of the activities you did in college to help you get into medical school?
Yeah. So some of the activities, I was part of a sports team. And I think that was very important because it showed that I was dedicated to something and that I showed up every day for something. And it also showed, so like dedication and hard work. You could say on your resume and you could say in your personal statement to medical schools, I'm a dedicated person that works really hard, but like, what's there to show for that? And so you want to have things on your resume that really show it's like, no, really, I am. Like, look at all the things that I've done, and I've been consistent with it. And then I was just part of like a diverse group of like a diverse amount of activities. So my mom's Cuban, so I was like part of like the Hispanic Association, and then I was part of a sports team, and then I was part of like a medical group. And so just like a couple things that you're very interested in, I think would be useful. I did some like research also, which they sometimes like to see. Yeah.
And then can you share like some of the greatest challenges you faced, like in college and then medical school and then now residency? The audio is a little weird. I'm not hearing you fully.
Yeah, I am also having that issue.
Is it the Wi-Fi? I can't hear you.
No.
The Wi-Fi's are red. Okay.
Anything?
We can hear you just fine now.
Perfect.
Okay,
Yeah,
there
thank you.
we go. I don't know what happened. My like AirPods aren't even like nearby and it just connected.
Oh.
Okay. Low battery on my AirPods. Okay, there we go. There we go. There we go. All right. You're still there, right?
Yeah.
Okay, great. Okay. So Abigail, you asked me something, correct?
Yes. What are the greatest challenges you faced in college, medical school, and then residency?
Not getting perfect grades, like not having a perfect 4.0. Like my high school GPA was like much better than my college GPA. And then my college GPA, I had to do a post back before going to medical school. And then even medical school, like I think one of the biggest and realest things that no one talks about is like, it's not going to be perfect. And we expect ourselves to be perfect in high school and in college because it has to be perfect in order to get into a medical school. And there's like so much pressure. And I think just not getting straight A's was it was like a challenge in the sense where it was like mentally challenging. I was like beating myself up. It was really emotionally difficult. And that was the most challenging. And that's there for high school, that's there for college, that's there for medical school. So it's just the stressing on yourself to have perfect grades or to do your very best and still not getting perfection. I think a lot of us strive, or I think a lot of us are perfectionists in this field. And it's not good for our mental health at all. And so I think that was the biggest challenge, like just figuring out what are the tools that I could use, and like finding like seminars for like mental health, just things like that is really what helped me overcome a lot of the struggles, a lot of like the emotional struggles. Cause let's be serious, like that's what like really is challenging about medicine. Study tips for college and medical school. Studies. So I would say like high school is so different, college studying is so different than medical school, and same, medical school is so different than residency. So I would say explore study tips. What works, have confidence in yourself with what works, and collaborate. You don't always have to study alone. So definitely collaborate with other students. And then do you have any advice on choosing medical school? How many medical schools did you apply to? So advice on choosing medical schools. I applied to US medical schools my first time around, but like my MCAT scores were too low. And a lot of people just apply again if they don't get in the first round to US med schools. I chose to apply to a Caribbean medical school. And I got in the first round, and it worked out fine. Caribbean medical schools are a different breed of medical schools. There's more students, and I mean, that's one of the main things. You still will become a doctor out of a Caribbean medical school. You'll still get a great residency. A couple of my friends are surgeons. So if you want to go into something competitive, it's still possible. It really just depends on you, just like anything else in life. Like it's whatever you put in, that's what you're going to get out of it. Do you have any advice on choosing medical schools? We just hit on how many medical schools you apply to as many in the US, like apply to as many as you can, unless you know that you have a shoe-in at a certain medical school, then maybe you could back off on like 130 plus or whatever it is right now. How did medical school affect your mental health, and how did you right? So yeah, Laura, that's a great question. And I just touched on it a little bit, but like, I would love to expand on it. I did this amazing course when I was 21. It was like right out of college, and I was like really stressed and I was really overwhelmed. And it was like this 3-day online, or now it's online because of COVID, but like a 3-day online seminar that kind of like gave me like mental health hacks, I like to call them, of just like tools on how to overcome like any that blocked me mentally. Like anything that was overwhelming, I was like able to like overcome it and like be more confident and like just be like stronger overall. And that was amazing. It was called Landmark. So it was 3 days, insane, changed my life. And like, I definitely like kept up with like, they do like life coaching. So like I've kept up with like the life coaching on that. And like, I saw therapists for like a short period of time, but like, I like life coaching, or life coaching helps me right now in this stage of my life more than therapy does, but therapy has helped in the past during different stages of my life. So, and my co-residents, like, I don't know, in medical school, like my friends and I had therapists, and it was like, oh, my therapist said this. Like, I don't know, like when I was growing up, like therapy was still like kind of taboo when I was in high school. I don't know if it's still taboo that you like in Gen Z world, like if that's still taboo, is it or no? It's not anymore.
I feel like it's getting better somewhat.
Yeah, it's getting better.
Okay.
Also, for some reason, the Zoom keeps glitching, so I'm not sure if it's a Wi-Fi issue. I just wanted to let you know.
Okay, sorry about that, guys. It's probably a Wi-Fi issue. All right.
Because the bar is red.
Yeah. Let me see if I could close out of some things. I have a million tabs open, so that usually does it. Let me close out of some things.
Does someone have their hand raised?
Yeah, I should ask my question.
Yeah, go for it.
So I have 2 questions. First of all, what kind of clubs or spirit courses should you take if you want to go to medical school? Like what things help, or what look good on a resume?
So honestly, it's what interests you. If you're a part of a club that you have no interest in, but it might look good on a resume, but you did nothing in the club because you had no interest in it, versus joining a club where you had a ton of interest. And so then you were like, let me take lead on this. Let me do that. Let me be the, like, let me be the treasurer. Let me be this, like you're so interested in it. That's what's going to stand out. So I wouldn't focus so much, like medical schools really do want well-rounded people. And medical schools are moving more towards that now more than before. So they're okay that, that you're in like, I don't know, like a singing group or something, Yeah, it says my internet connection's unstable. Do you guys still hear me?
It's kind of laggy, but it's fine.
Yeah, it's a little bit glitchy.
I could do it on my phone. That might be better. And I'll turn my Wi-Fi off.
Yeah.
Yeah?
Yeah.
All right. Let me do that. Hold on. There we go. Okay. Good?
Oh yeah, perfect. Okay.
Yeah, this is gonna be better. Okay. So, right. So just do something that you actually enjoy and love, and then that is going to, because it will show how engaged you were in that club. So that's what I would say for which club to join. And now I'm just looking for, okay. Oh, and I lost all the questions beforehand. So if someone, like Michelle or Abigail, if you guys like want to read the questions that I missed.
Someone said, how did you manage debt after medical school?
So there's a lot of like financial loan programs that can support you in residency. So there's one that after residency, you can go to a community health center for 3 years and they pay back your loans. It's like a loan forgiveness program. So that's one way that's really useful and helpful. And then of course, like setting up like a payment plan when you're in residency. And then lastly, I don't know if it's like, it's probably not that popular, but like a couple of my friends were in like the Army or like Air Force, and they pay for your medical education there.
Okay, Chris said, what external opportunities did you get involved in during your time in medical school?
Say that one more time. What external opportunities
did you get involved in during your time in medical school?
So, okay, all right. No, I have a couple. I made that face because like there's like you have so little extra time in medical school. You're just studying all the time. But that's like mainly in the first 2 years. But I really like working out. So I joined like my med school's workout group on campus called Fit Club. And then I was like just like a participant in like the first year. And then in my second year, I became president. And then I like ran the Fit Club as president. And then I joined like the health and wellness committee, which the dean's wife was on. So that was like nice networking. And so I joined the wellness committee and like put on like a couple of events with them, did like a cooking class. And then my third year of medical school, that's when I started my YouTube channel. And my YouTube channel originally was comprehensive, all-inclusive sex education. And I did that because like a lot of the patients that I was seeing in the ER, they were teens coming in, they were like pregnant teens, and they just like didn't have education around sex. And so that's what I started. I just like wanted to provide information on like STIs, sexually transmitted infections, and HIV, and just like other, important things that I found to be like very important. And which helped out with residency because it showed that I had an interest in something that was totally unique, and it really, really stood out in my application. So that's why I say, do what you love, and it will somehow make it around and make it into your resume. Even if it doesn't, a YouTube channel has nothing to do with medicine, but it was like a passion that I had within medicine that had me want to educate people about certain things, and like residency programs loved that. Yeah.
Right. The next question by Ashley Kelsey. She said, do you have any favorite experiences from medical school?
I would just say making new friends. It's just like the community and the connection. I'm sure you all know, like in high school or college, it's just like really nice having your group of friends, even if it's small. I had like a very small group of friends, but like, we were really close. And yeah. And I went to a Caribbean medical school, so that was kind of beautiful and gorgeous in the Caribbean. So that was amazing. And I picked up a stray cat in medical school, and she came back with me to the United States. So that also was a great experience. Yeah, it's what you make of it. If you're an optimist and you are out there looking for good experiences, you're going to find good experiences wherever you are, wherever you go. You'll make it work for you.
Okay, Ruhat said, do you think special academic programs like Sci-Tech, AP, or IB are in any way helpful to prepare yourself for medical school?
Can you tell me what all of those acronyms are, please?
Do you want to unmute yourself?
Yeah, so IB is International Baccalaureate, AP is Advanced Placement, and Sci-Tech is Science Technology.
Yeah. So, and so just what was the question again? So if any of those help with getting into medical schools?
Yeah.
Preparing for medical school.
Yeah, for preparing for medical schools, yes. Like I was in AP class. I didn't have those other ones when I was in high school, but like I had AP classes in high school. So AP classes, I think all of those, what those just really help you do is it kind of like just hones and molds your study techniques. For me, like AP classes were, there was more work involved. There was more studying. There were more books. There was more reading. And I wasn't thrown off in college. I mean, I was a little thrown off. I'm going to be serious. Like, it was different. But it wasn't like I was taking just like basic courses and then I got thrown into organic chemistry, it's those courses are there for a reason, and they really are there to just hone in on your study techniques. So yeah, I would say that that would be the reason.
And just a quick extension, do med schools look at if you went to a special program? Because I do know they lower your GPA, so
I'm not sure if they, I'm sure that they would, but that's like a special program in high school.
Yeah.
I'm not sure. I don't know about that. There's a list of what med schools look at when you're applying to med school. I forget what that would be. I just remember what like residencies look at when you're in medical school. It's like your test scores. And so I think it's something similar with medical schools. They probably look at like your MCAT scores, and then they look at your GPA, and then they look at your resume or your personal statement. And so then there's probably something like number 7, 8, and 9 of what they look at. So I don't know where that lands on their list.
Thank you.
Yeah.
Are you able to see the questions, the new questions in the chat?
And yes. Do you have any favorite experience from medical school? And how do you choose family medicine? What advice do you have for choosing a specialty in medicine? That's a great question. So like I said before, favorite experience from medical school is just going to Caribbean medical school and just making new friends. That was fantastic. And then family medicine, and what advice do I have for choosing a specialty? So I'll start with that one. My advice for choosing a specialty is to just apply yourself in medical school in your 3rd and your 4th year. So when you get into med school, your first 2 years, you're just studying your first year is all the normal, or at least this is how it was in my med school, but like your first year is like everything normal that happens in the body, right? You're just learning all the normal processes and like physiology, anatomy, biochem, all that stuff. And then your second year of medical school is like all the abnormal processes, what could happen when, pathology, anything that's abnormal. And then your 3rd and your 4th year are your clinical years. And that's when you get to rotate in everything. And you get to like be in the OR and see what it's like to be a surgeon or an OBGYN and deliver or, watch deliver babies and just things like that. So when you're in med school, I think that that's the time where you're going to really figure out what it is that you want to do. It's really early to commit to something right now. If you want to commit to something, that's fine too. But, wait till you get there. There's no rush. And there's no, prize for claiming that you want to be something right now. I chose family medicine because it has a lot of flexibility. For example, like I could work as an ER doctor because I am trained to see children, old people, and adults. So if I want, like I could go and just get a subspecialty or like a short fellowship in ER medicine as a family physician. And it's just, I have a lot of flexibility with my job, or once residency ends. And yeah, I think that the program, like family medicine programs are just like wholesome. They're just like, wholesome and like educational, and you're working with like really good people. Yeah. Some specialties that tend to, I don't know, be more cutthroat than others, but that also might be changing, and that also depends on where you'll be. So that's not for everything. What other doctors and health professionals do you work with? What's your favorite thing about your work environment? So I work with a lot of people. So I work with nurses. I work with physical therapists, occupational therapists, mental health therapists, social workers. These are people that I'm interacting with on a like day-to-day basis. And then like administration also, but that's not healthcare. And then my favorite thing about my work environment are my co-residents. Yeah, just like the people that I work with. It's just fun. They make it fun. Yeah.
Can you describe how your typical workday is like and what family medicine residency is like, and also how often you see patients a day?
Yeah, that's such a good question, Abigail. Yeah. So, okay. So every month we switch into something different with family medicine, because family medicine is a residency where you're like, okay, if you are the only doctor in this area, like you're gonna have to deal with everything. It's not realistic. Like if I'm not trained in delivering babies, like I'm not going to be delivering a baby. But in family medicine, if I wanted to be trained in that, I could, and then I could deliver babies. So it depends on the rotation that you're on. So my hospital is, or my program is very like hospital heavy. And which means that like I'm in the hospital a lot. So I can be responding to like code blues, for example, like when someone's heart stops and like I have to like, they call it like running a code. And so like I'm there being like, all right, push epinephrine, like push this, do that, like stop heart compression, start chest compressions, like all that stuff. So like you really have a lot of responsibility and power, I guess you could say, which when I was in high school, I'd be like, no, never would I ever be able to do any of that. But it's cool to think that I am. So I just finished a hospital rotation. So as an intern, which is my first year of residency, right? Like right after med school, you go into residency. So my first year is the Grey's Anatomy year, if anyone watches Grey's Anatomy, okay? So I'm Meredith Grey. And so I have to see, they give me a lower patient load. So since I'm an intern, I'm still just learning, I'm a baby doctor, they give me like 3 or 4 patients just in the hospital to take care of, like just to make sure that like I keep everything at bay and like don't kill anybody. And so I just have to like manage these 3 or 4, maybe sometimes 5 patients. Maybe I'll have like a patient with diabetes who came in because they had a heart attack. So now I have to talk to the cardiologist and be like, okay, what medications are we stopping? Are we starting? Which are we adding since they just had a heart attack? These are what the guidelines are. When you have a heart attack, you need to start on these medications, but they also have diabetes. So we actually can use this medication instead of 2 separate ones because this one helps with the heart and it helps with diabetes. So that's all things that you learn in medical school that, you'll, and in residency that come to you eventually. But, so like in the morning, so I wake up at like 6 and then I get dressed, whatever, I go to work. At 6:45, I'm in the hospital and the night team who just worked. So like my co-residents, they do sign out, it's called. And so they're like, okay, we had this patient, this is what happened overnight. So like, you kind of like just take a couple notes. It's like 10 minutes long. All hospitals do sign out. And it's just relaying information from one team to the next. And then in residency, you always have lectures. So like you're always learning because residency is just like extended medical school, but it's school for doctors because you're still learning in residency. So we have lecture every single morning from 7 to 7:30. And then we go to the floor and we meet up with our attending, who's like the senior doctor. And it's like me and just 2 other residents. And then we meet up with our senior doctor and we go through like the whole list of patients that we have, which is usually like 20 patients. And then we assign everyone different patients. And then we go sit at the computers. We like read about our patients, get to know them a little bit with their like labs. And then we go and talk to them. And then after we go and talk to them, we talk to them, we do a physical exam, we ask them questions, we get any, pieces of information that we might be missing. And then we go back to our notes and we fill in the notes. So medicine also is a lot of note taking, which is not something that, they really teach you in college or anything pre-med related. It's like a lot of note taking. Which is kind of annoying, but it's also something that I think our system is working on. So hopefully it'll be a little bit different by the time you guys all are doctors or in residency. And then yeah, and then we usually just like meet up with our attending again, go over all of those patients, make sure everything's okay, make sure we put in all of our orders, make sure we spoke with the cardiologist or the pulmonologist or the nephrologist or whoever it is. And then we sometimes do some like afternoon lectures with our attending. And then we just like, we have to attend to other things in the hospital. Like if there's a call from a nurse who needs something from another patient, then we, you know, attend to that. That's all hospital, but like inpatient that's inpatient hospital. Outpatient is just like a doctor's visit, you know? So like when you all go to your doctors, like that essentially would be me. And so like family medicine is a lot of outpatient. And so you're just seeing patients in the clinic, in the office, just dealing with like acute complaints, or you're dealing with like chronic complaints. And yeah, so that's just like a little bit about what our day-to-days are like. And then I see another one. How do you tailor your approach to patients when you meet patients of all ages? That's such a good question, Chris. Honestly, like I mentally prepare myself beforehand. If I'm like going in with a 5-year-old, I'm like, okay, what was it like to be 5 years old? And then just think about that for a second. You know, it's just getting to know your patients. You know, if you're coming into like, you know, I had an 87-year-old lady today, and her, you know, her husband died, and, you know, years ago, but she's alone. And so you just kind of have to like, that's where the empathy part comes in with medicine, where it's just like, where you have to just like think on that for a second. It's like, whew, like, wow, like she's just like alone out there, you know, like that must be really hard. And like this interaction right now is like a very vulnerable experience for her, where, you know, she could, you know, cry with me, or she could share something vulnerable with me. And I'm just there like holding the space. That's what I like to say. You know, and of course, like addressing any complaints or anything, you know, medically that might be going on. But for a lot of patients, like just being there and listening, it speaks volumes. It does a lot for them. So you tailor it just by knowing that they're a human being dealing with their own struggles and their own anxieties and their own stressors, and that their life isn't perfect and neither is yours. And you just relate to them on a human level. Yeah, that's a great question.
I have another question. What are your opinions on how medicine is depicted in TV? Because I know you were talking about Grey's Anatomy, so I just wanted to be curious about that.
Yeah, there's a lot more sex in the TV show. And there's a lot more drama. Like, I don't even know. I stopped watching Grey's Anatomy after like season 4, when they were like a cruise ship, and then also the hospital caught on fire, and also it's like flooded to like level 4. And I'm like, absolutely not. This is ridiculous. I was like, I'm not even a doctor yet when I was watching the show. I'm like, I'm not even a doctor, and I know this doesn't happen. So like, yeah, a lot of shooting. Yeah. Which, I mean, I guess, you know, depending on where you are in residency, like that could be a thing. Where I am, it's not. But I do have to say, guys, that I had a crazy awesome case where like I almost had to like jump on top of the patient's gurney and like start massaging the person's heart, like with his like rib cage open. It was like a very almost situation, and I was like that close to doing it without actually having to jump on the gurney, but like having to like massage the patient's heart because he was dying, and we saved his life. So that was awesome. And in the sense of like medical awesome, scary in the sense of like, you know, that was happening to a human being. But you also just have to remember that like this also is a job. You know, you're going to see that over and over and over again. It's just like kind of like sad to say, but like it's that like death, like you're dealing, like death is like your daily job in medicine, depending on what you do, but in residency, usually. So like that aspect of TV shows, like the roller coaster of emotions and doing like crazy stuff that you only see on TV shows, like that also happens. Just probably not to the extent and not as often. And who knows, maybe the sex part does happen, but not at my program. And I have a boyfriend, so. Hold on, I know we just got another question. Let me see. Coping with death in medicine. Ashley, I'm still trying to figure that one out myself. So I just got off like 1 month of hospital rotation. And before that, I was on 2 weeks of night shift. And on night shift, it's like a lot less people in the hospital, like a lot less doctors in the hospital. Like there's like 3 doctors for the entire hospital when usually there's like 10 to 15 during the day. And I was like crying almost every day. Like that's like one of the, realities of medicine. Like there's nothing yet that, and maybe there never could be, but like there's nothing to implement you figuring out how to deal with death. Like it's difficult and like you're just seeing it repeatedly and it could just be like a lot. And then sometimes, and then after a while, it's like, this is just normal. Which I don't think is like a bad thing either, because like death is normal, but like we don't normalize it. It's like a very like strange out there concept to human beings. I don't know, animals are different. They're like more what's the word I'm looking for? Transformed than we are. Anyway, what teenage job would you recommend to gain skills that help in college? Honestly, anything that you like to do, like anything that you would like to do. It's anything that interests you. If you, this is the time to do it. Just do things that are interesting to you. It doesn't matter what it is. I wouldn't even say something specific. And then how do you start to volunteer? Who or how do you contact or approach someone to volunteer under them? So when you're in high school, if there is like a pre-med, like a pre-med club, then I would get in contact with them. If that's not an option, I would look at honestly, like your doctor's office, like see if your doctor is, can you like, I don't know, do something at your doctor's office, or if there's volunteer opportunities. I think volunteer opportunities that are right there in your backyard, like there's always something to do. So I think that you could just look online for that. There's like so many options online where it's just like, volunteer organizations. That's what I would suggest. And then hold on, there was one other question. Enlightened, that's the word that I was thinking of, by the way, that animals are more enlightened. Okay. Anyway, what advice do you have for picking a major as a pre-med in college? This might go against some advice that people say, but again, pick a major that you love. Like if you don't love biochem or biology, like don't be a biology major just to put it on your resume. I was a Spanish major, guys. That's it. Like I was a Spanish major, and I took pre-med classes. It's not always necessary, but talk to your college advisors, see what other pre-med students are doing. You don't always have to go with the flow, and I highly recommend that you don't. I highly recommend that you stand out. If that's, one piece of advice that I have to give everyone, like find your calling that has to do with medicine or doesn't have to do with medicine. Like I said, my YouTube channel was my calling, in medical school, and it just happened to, deal with like medicine kind of. sex education. It like kind of, but it had me stand out and it showed that I had a passion for something. Just get in all your prerequisites and make sure you stand out just by being you and exploring your options and seeing what you love. That's really all you have to do.
We're reaching almost an hour, so I have did you have an aha moment when you realized that you wanted to be a family medicine doctor? And why did you want to be a physician versus other careers, like I guess a nurse or PA?
Yeah. Great question. So I don't think I had an aha moment with family medicine. I think it was really just like a slow and steady understanding in my 3rd and 4th year of medical school of like, oh, like this is what it's like to be a surgeon every day. And it was like, yeah, no, I don't want that, or like, oh, this is what it's like to be an OB/GYN every day. And so I wouldn't say there was like an aha moment. It was definitely like slow and steady course of just like weighing out all my options. And then doctor versus PA versus nurse, whatever, anything else in the medical field. I know I needed something challenging. I needed something mentally challenging, like that I really knew that I wanted to work for it. Where it wasn't just going to be handed to me, where it wasn't just, I could do a couple things and get a degree. Like it was, I'm not saying that that's any specific, that really goes for like any position inside healthcare or out. But I know that I wanted to, I just have like this drive in me where I want to work my ass off. And I knew that the most challenging thing that I could do was to be a doctor. And if I wanted to call the shots on things, again, doctor. If I want to be making autonomous decisions, doctor. So I liked the idea of being in that position, just because I knew that I could accomplish a lot and I wanted to challenge myself to see if I really could accomplish a lot. And yeah.
Okay, thank you so much. Does anyone else have any last question? All right. Okay, so I don't think anyone else has any questions. Thank you so much for coming. I really loved, all your answers, and just thank you so much for answering all our questions. I know it was a lot, but I don't know. I just really loved how personable you were and just how realistic all your answers were. So thank you again.
Yeah, of course. Thank you so much for setting this up, Michelle and Abigail. You guys are so amazing. Yeah, good. I'm so glad everyone enjoyed it. You're welcome. Of course. Yes, of course. And good luck. It is so possible and doable.
All right. Have a great rest of your night. Thank you so much.
Thank you. Bye, everyone.
Bye.